Hey, everybody, welcome back to the show. So, today, Will and I are going to have a conversation about integration for psychedelic therapy and a lot of the nuances involved there. And it's both a personal interest of both of ours. We've been talking about psychedelic integration for a very long time at this point, way before IPI had a program, right? We've been talking about this stuff for probably a decade. So this is a fun topic for us, and you and I both have had we've seen a lot of clients in the course of our career where we were probably doing psychedelic integration before it was even a term floating around that much, because we saw a lot of people coming into our practices that had psychedelic stories, like college students and different things. So there's a lot to talk through here, right?
Absolutely, yeah.
Yeah.
Yeah, it's an important topic, and as you said, it's more in the news or more in the conversation amongst people involved with either psychedelic research or ketamine assisted therapy now. But as you said, it's been going on for a long, long time. Arguably, it's been going on for thousands of years before anybody knew what to call it. But yeah, it's a key aspect of getting the most out of a psychedelic therapy experience, or a religious psychedelic experience for that matter.
Right. Well, this topic started for me, as you know, when I was 19, and I had a psilocybin experience that rocked my world. And I went to talk to a psychiatrist about that because I was pretty messed up after. And that was actually an integration session that no one had any idea what was going on there. Of course, you would have had to find, a needle in the haystack at that point in time in 97. No, sorry, 94. It was 1994. So, needle in the haystack to find a person that could have helped me integrate that properly in 1994.
I'm
pre-internet.
Curious, what did the psychiatrist tell you about in that meeting in 1994? I'm so curious what was said there.
So, what was said was what is sort of an old view on this stuff, which is, it sounds like the psychedelics woke up something that sort of like, they didn't use the word psychotic disorder, but basically like woke up a sleeping giant around mental illness. Now, they were partially right in that it woke up a trauma giant, but that's not what they were meaning. They were meaning like, it looks like, it kicked off a big, mental illness issue here. And, I saw a pharmacologist and a psychiatrist. Pharmacologist was more on the psychosis strain in his head of what it woke up. And the psychologist was more in the not otherwise specified every disorder problem, which was closer to the real issue. But it was more of like a manic depressive thing when they didn't know that Paxil was an issue with that. So he started me on Paxil. But the first psychiatrist started me on Risperdal. So he was more on the psychosis strain in his head. So they were like, oh, you had something already kind of view. You had an issue that was kind of at bay. And, the psychedelic, but it was more like mental illness versus like a trauma lens, obviously, back then. So, that was sort of a view back then, like psychedelics could, maybe you have schizophrenia and the psychedelics kicked it off kind of thing. And, that was kind of the view back then.
Well, and it's still the view. I think it's a prevailing view.
Right.
At this point in time. And, for me as a psychiatrist, I was blown away when I first came across the notion of a spiritual emergency or spiritual emergence, as opposed to everybody having a everyone having a psychotic experience is having a psychotic disorder.
Yeah.
That was a really new, or even like Kundalini, overwhelming Kundalini rising experience. I didn't know anything about any of that stuff as a psychiatrist.
Right.
And I'm curious if you feel like that old perspective from '94 that you received of, okay, you're waking a sleeping giant of serious mental illness. Do you think that's always wrong at this point in time? Like, what's your view on that at this point?
I don't think it's always wrong. I think that my view on that is you have contraindications for some of these medicines. It's like someone that has a bipolar propensity. It's like you don't really want to give them a lot of MDMA, right? So you've got these contraindications going on, and I think that was psilocybin, that journey, right? And my particular brain has this sort of bipolar propensity to it, and so I think that it's not entirely wrong. It's like I got into a mixed mood episode after that experience that both has that side of my brain, but also it also flushed and forced all that trauma up in there. And so teasing those two out, I think, is a very interesting philosophical discussion that's hard to do. Trauma versus bipolar 2. That's kind of like an interesting thing. So I don't think it's entirely wrong to say, well, there's something there that it amplified that might be like a bipolar 2 thing. I think that's fair. I think obviously we know that it can send people into mixed states and manic episodes who have that issue. So I think that's fair. I don't think, though, that it caused the illness. I don't have the perspective that psychedelics like causes schizophrenia or anything. I don't think that's fair. And that view's out there, right?
Right. Absolutely. Yeah. Yeah, I'm with you. I think that there are situations where I would, very strongly discourage someone on a medical basis not to. I mean, there's the legal basis right now, which is Schedule 1 and all that, but on the medical side, discourage particular people with particular family histories or personal histories not to use either a traditional psychedelic or MDMA. But yeah, I guess what's happened for me in my perspective is I see that there are people like that, but then I see all these other people, maybe the majority of people who have a difficult experience with a psychedelic. I don't look at them as having an emerging serious mental illness anymore. Some of them I do, for sure, but most of them seem to have some kind of tap into a really deep level of either personal or collective trauma that they're working to integrate, which is kind of what brings us to the conversation for today about integration, right?
Well, you're bringing up another aspect for me, which is, when I think back to that experience, which did for me instigate a bipolar 2 type episode. I mean, that's fine, but it also brought up a lot of implicit trauma in that session. But one thing that's interesting is you're bringing up for me is, can somebody leave a psychedelic session and have PTSD from the psychedelic session itself? And actually have like serious PTSD from the psychedelic session. And my I've gone back and forth on this, but I actually think you can. You can definitely get so overwhelmed and have no support around it in the psychedelic experience and have no support to integrate it. It definitely could feel traumatic, and the nervous system can go into traumatic responses without the right support. So I would say that's another aspect of what I took away now from that experience, is like that personal experience for me. instigated a mixed mood episode. It surfaced a severe amount of complex PTSD on a somatic level from childhood. And I actually had PTSD from this session itself when I was there alone in my room and just being flooded by all of that. And I actually had to deal with that integration too, of just being like, that was terrifying. And having, kept seeing the visions of that night with no one to integrate that with me because they had no clue what was going on. So I'd say all three could happen.
Right. I mean, I think that there's a tenderness and a vulnerability of being on a psychedelic that is different by nature, just from what we know about what's happening in the brain on a psychedelic. That's different in nature from the vulnerability that we carry around all day, every day, where we could experience a traumatic event and it could leave a PTSD imprint on us. So I agree with you. I think there's a unique vulnerability there. And certainly, you and I have both seen our fair share of patients who had PTSD from taking a psychedelic in a unregulated, kind of unsafe environment. I remember a couple of people I treated who took a psychedelic at a music festival and, got really scared because something came up, and then got really paranoid, and then it had an interaction with the police, and it just gets really gnarly sometimes for people.
Exactly. Right.
But I think it's important because it's really underrepresented, this issue that psychedelics, and I'm saying this more to the general listeners, not so much to the psychedelic clinicians who listen to this show, but that psychedelics are amplifiers of what's in your mind. Right. And so you are going to encounter things that your conscious mind doesn't want to know. Now, that doesn't always happen. Sometimes people have euphoric, whatever experiences that are beautiful. But more often than not, there are things in our unconscious mind that are scary, that haven't been digested, that come up. And this is not regarded as a negative event. This is regarded as an opportunity for healing. But obviously, if you're not in a healing setting, it's going to be pretty hard to have a healing experience. Right?
I mean, during the experience, for sure.
Yeah.
Set and setting matter a lot. What might be useful here? So, because this is about integration. So what might be useful for us here, we talked about three things you might need to integrate, which is like, okay, let's say you weren't really well suited to take that medicine because you've got certain issues going on psychiatrically. So then you got to integrate that issue, right? Of like sort of this bipolar type episode starts happening, or then you also have the complex trauma that you face. That's integration. Then maybe you have direct trauma you experienced the night on your medicine with a police officer or whatever. These are all integration issues. These are all issues of challenge, right? That happened on psychedelics. A lot of other different things could happen. It could be you had an ego dissolution, right? You could have like a spiritual experience that was very challenging and scary. Fragmentation is a whole piece of that sometimes, where your ego has now experienced fragmentation. So this is like spectrums of like things that you might be integrating, insights, childhood insights that need to be integrated. And then there's like the whole spectrum of beautiful things that need to be integrated sometimes. Like you experienced euphoria for the first time in your life, right? Or ecstasy. I don't mean MDMA, but you experienced an ecstatic experience. an epiphany, right? And those need to be integrated too sometimes, right?
Absolutely. Yeah, I think you're speaking to the perspective that I agree with, which is that positive and negative experiences both can stretch us in directions that we're really not used to. And too often, I think, sadly, too often people kind of the rubber band snaps back the next morning or the next day or the next week, and the conscious, maybe more defended mind wants to reject what happened, and write it off and dismiss it as, oh, that was just a drug effect or whatever. And the opportunity for this expansion or this kind of workout for the mind to become more flexible, to become more open, gets missed, gets lost.
Right. Yeah. Well, let's start with the more pleasant experiences. I think it's actually an interesting place to start. We just kind of covered some range of challenging things, as obviously it's not exhaustive, but we didn't talk about what the integration looks like. But let's talk a little bit about the uniquely pleasurable experiences that can happen that might need integration and why. Let's start there. So I'm just, we were talking about this morning, but I'm reminded back when we were in, ayahuasca churches, and when I was down in the jungle, it's like every morning somebody, maybe it was me, would be like, I finally figured out my life. Like I finally figured out this thing that has been bugging me forever, and I'm going to go and I'm going to change it. And, I'm so excited that I have this insight about why I kept doing this thing in my life. And now I'm going to make this big change. And that was very common for me, what I saw in the jungle, of somebody coming out of ceremony being like, I've had the epiphany, I'm going to change my life. And sometimes it was radical, like I'm going to go get a divorce now. Today I'm ready. Sometimes it was a radical sort of change. I'm going to go quit my job of 10 years. I finally figured it out. I'll just say that many times when I knew the people going through that, or myself, it doesn't usually flow the way it sounds like the morning after. Or like I've seen consequences. I'm remembering a client of mine that came out of an ayahuasca church session, and they quit their job the next day. And I'm just remembering, months later, like the person regretted that decision, was having a really hard time. So I'm just curious if we talk a little bit about these sort of big, pleasurable opening insights, where it's like a lot of excitement coming out of these sessions and about making a change and feeling free, which later can lead to regret for some people. I'm just curious about what you think about that.
Yeah. Yeah, I'm reminded of a Brazilian shaman I was working with for quite a while, who told us that he had a student who, after ceremony, he realized that his father had been abusive to him most of his life, but this had never been in his waking consciousness, and it had never been a conversation with his father. And then he showed up at his father's home and just, ripped his ass and yelled at him. And the father was elderly and had a heart attack, on the spot. And I thought about that as an example of what you're talking about, of, there's a, what comes up for me is this metaphor that I've been working with of how long it takes to change our bodies. Like if we choose to take on a healthier diet, or we take on an exercise regimen, it could take a year, it could take 6 months or a year to start to feel significantly different if we're in a hole with our health. And I think it's kind of similar when you think about trauma being held in the cells of the body for decades or even multiple generations in your lineage. And now all of a sudden, the morning after a ceremony, you think, okay, from now on, my life is different, right? It's like, it's a thought pattern that hasn't been like the cellular machinery in the cells, the changes in methylation and acetylation of DNA, the changes in like what proteins are being made, the changes in like the signaling and who we actually are on that molecular level hasn't had any time to unfold, right?
Right. Yeah. Sometimes our ideas are faster than our cells can catch up.
Yeah. Yeah. It's like when we're working with someone who is a daily cannabis or alcohol user, and we tell them it's going to be a year of sobriety before you really can tell what you're going to be like. And so, yeah, to me, it's aspirational. There's this amazing opportunity that comes from fracking the unconscious with a psychedelic, and then we actually need to find out how to process that fuel that we just fracked from the aquifer under the ground.
Right. That's a good metaphor.
It takes time.
Yeah.
And discipline.
Well, and from let's say from a provider perspective, you're working with the person that's coming in super excited and amped up. Let's just say amped up. And they just came from some sessions and whatever, and they're wanting to make big changes. My perspective from integration with that is I always tend to say to people, well, is it going to hurt to take a week or two to make sure this is what you want to do? And a lot of times in a week or two, it feels very different for people, these big decisions. So that's been my kind of go-to when someone has a huge idea that gets generated during a psychedelic experience, and they, it would have big consequences in their life if they followed it. I always tend to try and slow people down a little. I think it's an interesting part of psychedelic therapy in general is to be thinking about the conversation of excitement after the session, and how the ego is not going away. Like, just because they did a psychedelic doesn't mean they don't have an ego. And so the ego can get excited and come up with, the ego could be expecting huge outcomes if they do some crazy thing and get very attached. Like, the ego doesn't go away, right? The ego could get very attached to an idea. So I think it's a very interesting aspect of integration that we don't always look at, like, what did this just amplify? That may be true for the person, but that, there's reasons to pace still. Just because they did a psychedelic doesn't mean we shouldn't talk about pacing it's just curious to me, this aspect of it all.
Yeah, it's a delicate moment you're talking about as a practitioner working with someone in integration, not to be a Debbie Downer or, rain on their euphoria parade, but to support them to really deepen their roots of the experience in various ways. And I think that's where the art comes in of, supporting and acknowledging and upholding the beauty of that euphoric moment or that insight without getting carried away and and losing contact with the ground of our being.
Right.
And
Yeah, I
making
think
impulsive decisions.
Yeah, and it's an important. I mean, it's a tricky moment because you're obviously wanting to trust the medicine and trust the client and just like just trust the process. But obviously, I think as a facilitator, we obviously also aren't in blind trust of just we know human beings are working with us for a reason, and they have egos and they need a mirror, right, to just bounce their perspectives off of. And so yeah, that's a tricky moment. It's a tender moment. Integration is a very tender moment in general.
Yeah.
Because there's so much. A lot of the work is in integration, we say, right? Like a lot of the effect on our lives is during the integration process of like what's going to actually start to transpire in our life.
Absolutely. I mean, 80 to 90% of the healing is integration, in my opinion. And I think it's important I just want to name that when folks have been very suppressed or depressed, or they've been carrying trauma and they have a release from some of that burden, it's a really common and beautiful phenomenon to see this life force begin to sort of pop out that's been in a hole for a long time. And that's to be celebrated as well. And, we've all, those of us who've been doing integration for a long time have seen this kind of rebound effect that can occur when that opening isn't integrated in a grounded way.
Yeah.
And that's extremely painful for people to that kind of come down from an unintegrated release.
Right. Definitely. I'm reminded of another pleasurable. This is really an interesting one. I had a client, I don't know, it had to be over a decade ago, that had this pleasurable opening on a psychedelic. And it was so pleasurable, it led into a panic attack. And then this person kept revisiting the experience of this overwhelming pleasure leading to a panic attack. I got to see the person years later and it was still happening, like whatever it was, every 3 to 6 months. But like serious panics. This person it was a woman. She'd just be like all of a sudden getting flooded by pleasure in her body. And it was so overwhelming, going to complete and utter panic. So this was a very interesting integration piece of pleasure.
Mm-hmm.
And this person came to me and it was going on for years, and was terrified of the next wave of pleasure. That's basically how the person started with me, describing, I'm terrified of this next wave of pleasure because it gets so big that I get crippled by it and it like crushes me. And then I'm freaked out for days. So this was a very, have you ever heard of this before? I mean, this was pretty unique.
Well, I think it speaks to what we're talking about, is that the positive experiences, quote unquote, can also be really terrifying for the ego.
Right.
That our sense of who we are is, if you're like most people, it's narrowly defined within certain parameters of what we can feel, what we're allowed to feel in order to know who we are.
Yeah.
Yeah.
Yeah. So, that was an interesting piece. And we did a lot of work with somatic work. I was very curious if there was a sexual trauma in there. And in this particular case, there actually wasn't one we found. But, we did a lot of somatic work of just working with pleasure, and really what was the fear of, what was the root of the work was, what was the fear of having so much pleasure? Where is it going? What's the biggest fear? And interestingly, my memory here is that particular fear was about that it was leading to death. Maybe I'm going to die. So Psychedelics are very fascinating when we talk about just experiences and then integration. Like that taught me a lot, which is that, pleasure could also be turned into death in a person's mind. Overwhelming pleasure could lead to death. I hadn't thought about that prior to that moment.
It makes me wonder about my own relationship to pleasure and how capable or how tolerant am I or how open am I to that level of pleasure? What would that
You're
do?
not. You're not. Yeah. Yeah. Right. I know. I don't let in that much pleasure. This is interesting too. Just more a meta conversation around pleasure is like how many people let in that much pleasure, right?
Right.
And psychedelics will sometimes send us there.
Mm-hmm.
So that was an interesting integration piece. It was cool to not have to pathologize it, other than I had my moment of being like, is this have a sexual, like injury in here, but I didn't hold on to that. And it was cool to just work with that. And that subsided over time as we just worked somatically around pleasure. So that was the integration for that person. Somatic work around pleasure.
Yeah.
So I think the takeaway for me of that piece that really is important here is that you have to sometimes integrate pleasure as well as pain in our bodies. It's not only just pain that is not integrated in our bodies. It's also pleasure not integrated in our bodies.
I feel like that's that imbalance between pleasure and pain is more and more pronounced. It seems like in our culture right now, like the idea of having a pleasurable time. This is just my own like hang up around pleasure. I think is it okay to have a pleasurable experience when so many people are suffering so severely right now?
Mm-hmm.
There's a lot that comes up for me around guilt and prohibitions around displays of pleasure and enjoyment. I know there's a lot for me in my history that is connected with that, but
I mean, I think culturally too, there's, this particular culture is interesting. Like, do we celebrate pleasure? And I mean, we celebrate in a lot of strange ways. Like if you're sort of watching social media for a cultural analysis, do we celebrate pleasure? It's sort of a very interesting piece of how we do that, right? We're not necessarily like celebrating the pleasure in our bodies. So I think this culture and many cultures on the planet, there's a lot of negative messaging about pleasure.
Yeah, and we seem to be fascinated with characters, let's say, in social media and our culture that from our judgmental mind, overindulge in hedonistic pleasure or overconsume, or they're over maybe sexualized or over whatever. And we're fascinated by these people.
Yeah. Yeah.
And
I think psychedelics they're gonna amplify something inside of us that we often are avoiding. That happens a lot with psychedelics, and maybe we're avoiding pleasure, and it amplifies that experience. Maybe it amplified pleasure just because that's what happened that day, and we're not avoiding it, but then we discover we can't contain pleasure that well. Of course, there's the experiences on psychedelics where you have mystical experiences that are very pleasurable, and it's no big deal. And the integration is just like this memory where it's just like, that was amazing. And like, there isn't a ton of, deep, dealing with the integration, because it integrated itself. I mean, that's the other thing I think important to say, is that there are tons of parts of our journeys on psychedelics that it integrated. Like, we don't need to rehash it over and over and over. Like, it did its thing, and it integrated, and it sequenced in our body. And that happens all the time also. I think that's important to note.
Absolutely. Yeah. Yeah. I mean, it would be kind of hard to get behind psychedelic therapy if you had to keep reintegrating the lesson over and over again. If you weren't getting traction or making progress and becoming more whole, more flexible, more capable of facing and experiencing your life, more confident to deal with life's challenges, it wouldn't make any sense.
No. And especially if, like, you had to rehearse a whole 6 or 8 hour session for the next, year, that wouldn't make sense either.
Yeah.
So there is a lot of integration that, we talk about integration as this thing that happens after, and that's what we mean by integration. But there is integration happening during the session itself. Like, we are integrating aspects that were not integrated inside ourselves during the session. That the medicine is actually working with us in that way, and that's happening, and that's the beauty of these medicines. But then there's sometimes, some leftover material that needs some more work. Often, right? Because so much is happening. A lot of the time, or nothing is happening, which is its own level of integration.
Yeah, I mean, there's always something happening. Sometimes we call it nothing, but
yeah,
we have names for certain things. But yeah, I think it would be good to talk about some of the common things that need to be integrated, in the days and weeks that follow a session. I mean, one of the big ones that I saw a lot as an MDMA therapist in the clinical trial I was involved with MAPS was negative self image, or negative self-talk, or just the deeply defeated kind of protected identity that comes from carrying trauma in your system for decades.
Right. Let me ask you a point of clarification now. Is this the negative self-talk that happened during the session, or is this like a rebound where there was positive self-talk during the session and then there was negative self-talk after?
It's the rebound is what I'm referring to.
Yeah.
Yeah, because with MDMA, people often, I'm glad you asked that, oftentimes will have a huge shift in their perspective about negative self-talk and negative image. There's often massive forgiveness for the ways that we had to cope to deal with avoiding flooding and dissociation that are, so common in chronic PTSD. And then the morning after, there's, especially in the beginning of the work, there's almost always a rebound of, that was just the chemical talking, or I opened up too much and now I'm ashamed of what I shared with these people that I barely know, because the oxytocin, makes you trust people more quickly. And there's so much opening and so much self-love and forgiveness often that it's beyond the scope of what that person's identity or their ego is really used to feeling at all.
Well, what was your sort of, I know it's always unique with every individual, but with this sort of theme of, okay, like morning after, days after, rebound into very negative self-talk, shame, what's sort of your view that you're holding with the client in those moments? If you're going to share a view, what view are you typically sharing with them?
Well, I guess the frame that I have found really helpful in those conversations is this frame of parse work and internal family systems, where the rebound effect of negative talk could be looked at as one part of the person coming in to protect the vulnerable parts from the risk perceived around not judging oneself. Judging oneself is a form of self-protection. And to give that self-protection up is a risky endeavor. So, looking at which parts need to be protected, looking at which parts are doing the protecting, looking at how the whole system is either communicating between the parts or not, usually not, really helps knit the self together. And that's a big part of the integration process, is seeing these parts that have functioned more or less in isolation from one another come into more of a teamwork kind of effect, which is kind of like a big oversimplification of a very complex process. But
Yeah.
so I think parse work is really useful in these more cognitive integration pieces.
Yeah, I think that's great. I mean, that's where I would take it, is parts work. I think it's really helpful with this particular type of piece where a part comes back online, waving the flag and saying, like, I'm not going anywhere yet.
Yeah. Wait, this person really is a piece of shit.
Yeah.
And I know it's true.
Right.
And so, Dick Schwartz's method is really potent and useful in these situations where, in his language, an exile, or a part of us that we have banished, usually because they're very wounded, is perceived to need a really harsh protector, often, to keep it safe. So these polarizations inside the self don't allow for a lot of flexibility in the way that we encounter new situations.
Right.
So it's part of the process, and that could take days, weeks, months, years to integrate.
Right. Yeah, absolutely. I mean, having such a big opening, right, from a part that has been there's different parts here, but the part, let's say the protector part, that's, angry and whatever it is. It could take a long time to integrate it. And when there's this opening and the other parts start speaking up, it's pretty amazing.
Mm-hmm.
And the self starts appearing, and it's powerful.
Yeah.
Well, let's talk a little bit about integrating. This is a little different. Integration might not be the best word, but it comes up in integration. It's an important topic. So you see this emergence of psychiatric symptoms. Let's just talk about more. You see an emergence of some bipolar symptoms in somebody, right? Mm-hmm. And I think that this is usually more common in younger people because, people that are older usually have the symptoms already throughout their life. But let's just say this is more common when we see these sort of young college students coming in, or somebody, and they're younger and they're like, did a psychedelic, and then we see this emergence of some bipolar symptoms. And I'm just curious how you relate to that how you have related to that as a psychiatrist, and what you would say to that person as part of their integration of what just happened.
Yeah, I mean, the first thing that comes to mind in experiences I've had like that is, let's hold off on taking another dose of that psychedelic while we sort through what happened here.
Right.
It might sound obvious, but college students oftentimes don't think that way. And psychedelics taken in a recreational way, I think a lot of people relate to them in almost as if, well, I was just gonna smoke a bowl, or I was just gonna, drink alcohol, but I decided to take some LSD instead. Like that kind of mentality is I found really, really common actually in young people. So that'd be the first step, is let's press pause on that and let's try and sort through. And, in a young person, I'm also concerned about, is there an emerging bipolar disorder, or, what is going on here?
Yeah. Right.
In more extreme cases, if there's somebody's up for 2 or 3 days in a row, like, I'm probably going to treat them with medication for a manic episode. And
right.
Doesn't necessarily mean it's a bipolar diagnosis. It could be a substance induced manic episode that, never occurs again. But
right.
Doesn't mean I'm not going to be aggressive about treating it and helping them get their feet on the ground. So
right. Yeah. So it's sort of like psychiatric first aid for, some intense psychiatric symptoms that appear.
Right.
Trying to wrap our heads around, is this just going to go away, or is there something been here a while, like the sleeper that, I was told, right?
Right.
Yeah. Yeah.
Yeah. Yeah. And I think that's that diagnosis of substance induced mania is not maybe recognized enough. I think we tend to think in this more traditional perspective you talked about from 1994, that this is a person who has a mood disorder and the substance just revealed it, as opposed to, okay, well, what was involved? Was there cocaine involved? Was there, these stimulants that can really, in a recreational setting, someone could be using 4 different things at the same time,
Yeah.
So.
Yeah. Well, the other thing I have seen with people that have these sort of episodic issues, like, usually it's not a sleeping giant. Like for me, or like, usually you can see the symptoms in a person's past once you start doing your assessment.
Right.
It's just like they're a little more exacerbated right now, but it's not like, usually for a person that actually has an issue that they're going to have for a while that really needs to be worked on, a psychiatric issue, like, it doesn't usually appear out of nowhere. In my experience, like, when you do a good thorough assessment, you see a lot of different symptoms, usually over the course of a person's late adolescence or in different places.
Right.
Yeah. Yeah. And then if we switch gears a little, I think something very common is integrating childhood trauma, right?
Yeah.
Like, that is very common.
Huge.
Yeah. And that can look a million different ways about how the course of that unfolds, I think, in integration. And a lot of times, sometimes people are remembering very explicit memories from childhood that they need to work through. And a lot of times there's just a ton of implicit somatic experience that's very challenging to people that they experienced on their medicine, and then they need integration around. And they're still feeling it. Like, doesn't like shut off for a lot of people. They do a session and then, like, they're getting in touch more with a somatic experience that's always been in their body.
Right.
Cause it's, but it's been dissociated from.
Exactly.
And then now it's here,
really
and then you just feel it, and then you feel it and it doesn't go away.
Yeah. And that can panic people when they're having an ongoing so-called negative somatic experience after a psychedelic. And,
right.
You can start asking yourself, is this how I'm going to be from now on? Is this the rest of my life? And that's where the skillful integrator can help you sort through that. It's so important to continue sequencing the somatic experience, so it's not stuck in some kind of semi-digested way.
Right. Yes, I think that's a very common thing in integration that needs to get addressed. And I think validation is very important there. Of normalization is so key. Of we don't know, but you're likely experiencing an old feeling that has been there with you, and it just needs to be worked through. And that happens, and people work through these things all the time. I think normalization is very important for someone, especially if they're naive, psychedelic naive, and they haven't done psychedelic therapy yet. And then all of a sudden now they're like getting in touch with core pain that's been a ghost that's been bothering them their whole life, but they haven't been able to feel it in their body fully.
Oh, yeah.
Yeah.
Yeah. And then there are also the folks who consider themselves to be psychedelic, maybe psychonauts or people who have experience with psychedelics and think, okay, well, I've done a lot of work here on a psychedelic, and therefore I'm not going to get destroyed by my next psychedelic experience. I'm speaking from, I'm remembering this occasion. Yeah, I've shared this with you before, where it was almost 6 years ago that I got trained in ketamine therapy. And at the training I went to, the facilitator thought it was a good idea to give 1.5 milligram per kilogram dose, IM, so intramuscular shot, on 2 days in a row. I would never sign up for a training like this if I knew then what I know now, but that's what I signed up for. And it produced a very challenging integration period for me, where I was very fragmented. We should talk a little bit more about fragmentation maybe, but I went into this state of deep fragmentation where everything was overstimulating. The lights and the noises in the environment I was in were way too much for me to tolerate. I couldn't really gather my thoughts very well. I was on my way to a conference. I was on my way to the MAPS conference and in California. And when I got there, I was still very affected. But to your point about normalization, this is what triggered the memory for me. Is I started telling people in the MAPS community what I was experiencing, and I had people say, "Oh yeah, I did X, Y, or Z psychedelic, and I was out of my mind for 6 months, and I came back, and I'm a normal person now." And and all these ego death experiences came forward, and it actually helped me a lot.
Yeah.
To know that, because I was starting to get scared that maybe I broke my brain or something like that, and so it was really in some ways a big blessing, even though I felt very vulnerable not being at home. It was a big blessing to be around so many people who know a lot about integration and about these overwhelming states, and I didn't meet one person who pathologized my experience.
Yeah. And we have it's interesting, right? Because let's say you get really fragmented like that, right? And if you go to a psychiatrist who isn't up on, or a psychotherapist too, who isn't up on psychedelic therapy, like they're just going to hit you with dissociative spectrum disorder stuff. Like you're having derealization and depersonalization, and that's extremely painful and uncomfortable. And whatever, like philosophically, you are probably,
I was having that.
You were depersonalized, right? That's the issue. You couldn't locate yourself,
right?
That's what's so painful, right? You can't locate oneself, or you overly locate yourself is another aspect of depersonalization, and that's really scary. And it does integrate. I haven't seen someone that never came back from that type of fragmentation.
Right.
And like you said, like my experience has been that coming back from those places and seeing people come back, like usually there's like this huge teaching that comes out of it for a person. There's some real material that comes out that's more growth oriented as the integration of those parts come back together.
Right. I mean, that's what is meant by this kind of adage in psychedelic therapy, that the harder experiences are often the most fruitful in the end. For me, I was integrating that experience for probably at least a year with my therapist when I got home, and I arrived at a much deeper understanding of some very core things about myself and my personality that was really useful. And there
Yeah.
are, going back to what we said earlier about folks who probably are not in a good position to take psychedelics, especially not in a medical setting. I certainly I've had patients young people who overdid it with any number of substances, and a handful of them didn't were not able to integrate and remain in chronic mental illness. I've seen that. But
Yeah.
I never ascribed that to the psychedelic did that to them. I ascribed it to these are people with the sleeping giant that uh, might have been accelerated in waking up, but it wasn't like an injury from the psychedelic, from my perspective.
Yeah. Well, I think one thing that's really interesting about very challenging big experiences, particularly fragmentation, or sometimes the integration is learning when to say no. Like, you know what? I know myself, and actually that dose is not right for me. It's too much for me, because that's where it sends me every time. I remember there was a student in our program that asked, like, "Hey, like, this is what happens every time to this client. Every time, like, they're just having this huge ego fragmentation. It takes months and then they do it again, and they think that the path to freedom is to be able to not fragment." This was the question. Is the path of freedom to just keep going and going until I stop fragmenting? And I think that is in some medicine communities, they say, just take more medicine, just take more medicine. And sometimes the integration is learning about oneself and being like, you know what, constitutionally, whether you're slow metabolized, whatever it is, that's too much for you. And maybe that's medicine's not even right for you. Because sending yourself into fragmentation over and over and over in your life, where you're basically always living in fragmentation, that to me, that's not integration. That's not an integrated way of being in the world. Actually, you're promoting a disintegrated way of being in the world. So I think when it comes to fragmentation, sometimes you also have to know when to say no as part of the integration process, or if that's the provider, even giving that feedback of saying, like, I think the answer here is to stop doing that. Like you said, with these, some chronically mentally ill people, and then they'll keep taking psychedelics, and it's not the cause of the mental illness, but it sure makes it a lot worse.
Right. Right.
I definitely, I didn't treat a lot of people with schizophrenia, but I treated enough that were doing psychedelics, and it was definitely making them worse. And
Sure.
I was like, I can't even work with you because you're doing psychedelics and you're so fragmented, right? And you're so psychotic. Right. And like, so I think that, and I'm not saying that, it always leads to more psychosis or whatever. Like, there's obviously a lot there, but it's just, sometimes it's about saying no and integration. Like, you're learning your own boundaries around how you work with yourself.
Right. Well, there's this important concept of the window of tolerance and what level of challenge we need to experience to grow. But then there's another level of challenge that's destructive, right?
Right.
It's like, how much weight can you put on your back? There's a certain amount that causes you to get stronger, and there's a certain amount that'll break your bones, right?
Yeah.
And
right.
why would we think that we should just keep going back until our bones don't get broken?
Right.
It doesn't make sense.
Yeah. I mean, there's too much of anything in the world. And
right.
Obviously, whether it's psychedelic therapy or weightlifting, like, you can strain your body to where you injure yourself.
Sure.
And it just takes a really long time to repair.
Yeah. And sometimes it's tough for the individual to see what you're talking about. Like, you need to have someone else point that out to you. Hey, I
I
wonder
think
if,
particularly with psychedelics, it's
yeah,
tough because
yeah,
a lot of people who are in dark places, they want some help. Like there's, they generally want to get better.
mhm,
And the road to seeing through the puzzle of how to get there, it can get very confusing. And you could think like, okay, I just keep doing this thing and it'll actually get me through it, even though each time I do this, I feel worse.
right.
Um, but I trust that it'll get me through it. Like, and sometimes that might even be true, right? So it can get very tricky. But that's why I think it's so key to have good, educated people around reflecting what they
Yeah,
see.
right. And, or to have good friends who are willing to have difficult conversations with you,
Yeah,
there, and then, not all substances are created equal in this regard either. I think about so many folks I worked with here in Boulder who had chronic psychosis, schizophrenia, where, you know, cannabis clearly unraveled them, made them worse, chronic
sure.
misuse. And like you said, it's really difficult to have a conversation about, look, I see you falling apart. I see you not taking care of yourself. And so sometimes it takes a circle or a community of people to say, hey, let's take a look at this, you know?
Yeah. And sometimes it's not even as severe as psychosis, right? Like
Right.
I'm just thinking over the years, like there are people where it's just like you see them turning to psychedelic therapy or psychedelic medicines, but like you notice the pattern gets stronger of the thing they're trying to avoid and they can't see it.
Right.
Um, because they're turning to like they don't want to take responsibility for dealing with the pattern. So they like having a big experience on psychedelics.
Well, it's like
So that's
anything
another
can be,
aspect of integration, right? Which is like
yeah.
you can actually use psychedelics as an escape from you can fool yourself and use psychedelics as a place to get relief from the thing you don't want to just go deal with in your life, which might be overwhelmingly challenging. So there's so many nuances to any medicine. Uh,
Yeah. I
I
mean,
mean, how many people are using antidepressants to escape from their problem and not actually ever deal with their problem, and they just feel a little better on the medicine, right? Like, and I'm not knocking antidepressants. It's not like there's not a time and place, but you could use any medicine as a place to just get relief and never change the problem. You could do that.
well, and as I want to honor the psychoanalyst who I saw, when I was a resident, who told me that anything could be used as a defense for anything. I mean,
Yeah,
anything, so to speak, good for you can be used as a way of not avoiding a way of avoiding your life,
right.
right?
Yeah.
Uh,
Yeah, anything could be. Now, the nice thing about psychedelics, they tend more often than not to find a way in there, whether you like it or not, and show you the problem. But, you know, you can use things for any reason. I mean, we had, patients over the years that were psychonauts that were not dealing with their life. And they weren't doing, I mean, the big key here is they weren't doing psychedelic therapy. It's a lot harder to pull that off with psychedelic therapy because then you've got a therapist in the area. And the whole point of psychedelic therapy is not to be taking psychedelics all the time, right? So that happens more in
when
the recreational space.
I agree, I've met a number of people who had, years and years of recreational psychedelic experience that when they first go for a psychedelic therapy experience, they will tell me like, holy cow, this is
Right.
not the same compound. It's not the same experience. It's like there's this it's like one of those statues with two faces on it where like one's happy and one's sad. Like there's this
Right.
two faces of a psychedelic where it's really it's really, really different.
Yeah.
And it's the
Yeah.
intention, it's the set and setting, it's the whole nine yards. But
Right.
yeah.
Absolutely. Well, should we wrap up here? Any last words?
Well, I think that we the human journey is long, and for many of us is probably short
Right.
for some of us.
For the fortunate group, it's long.
Yeah, and we encounter a lot of different challenges along the way, and there's sort of like this background observing, judging part of us that is always got an editorial commentary about our experience. And
Right.
I think for a lot of us, it takes the form of like, why am I suffering again? Or why am I having another hard day? Or why is this so much harder than I thought it was going to be?
Right.
And I think that's one of the important things that we face in integration in our lives, is this voice that thinks it knows what our life is supposed to be like, and usually thinks it should be a little easier than it is.
Yeah. Right.
So
usually does.
That's one of the benefits of difficult experiences, is that it can really undermine the authority of that part of us.
Yeah, I mean, most human beings somewhere inside of them believe there's never supposed to be a challenge.
Yeah.
Coming. I mean, most people could relate to the fact that, why do we keep getting surprised when we get challenged?
Exactly.
I mean,
that's what I'm talking about.
Every time, a trigger is inherently, everyone gets triggered. At some point during your week, you get triggered emotionally about something, which means you're surprised that you're going to have that challenge again in your life. You think that it should never happen again. So that's not going away. The only people that have claimed to got over that are enlightened people, and I don't believe them. I think you could actually transcend knowing that's happening, but I think it's still happening. I think it still happens in the emotional system, still happens. Maybe you can shut it down within a second, but it's still, I don't think you could transcend that completely.
Yeah, I think it's a matter of maybe how quickly we can remember our sense of humor about that whole, sequence of events.
That system. I'm still stuck in getting surprised every day. So
me too.
Yeah. All right. Well, let's end there.
Okay. Thank you.
All right. Bye.